In the 20 years since we've been able to map the entire human genome, how many genetic diseases do you think we've cured? 0. Because our genes are just a suggestion. It's ultimately environmental factors like diet and antibiotic use that transform a genetic predisposition into an actual disease. I'm Dr. Robynne Chutkan, gastroenterologist, microbiome expert, and author, and I am here to help you find gut bliss. On today's show, we're continuing with the gut-skin axis, and today we're talking about psoriasis, an autoimmune condition where skin cells accumulate into itchy, scaly patches, usually on your knees, elbows, trunk, and scalp. Now, a quick refresher on what an autoimmune disease is. It's when your body mounts an immune response to its own tissue. Your immune system mistakenly identifies normal organs as abnormal, and it starts to attack them. With psoriasis, that attack takes the form of scaly patches on the skin. With ulcerative colitis, it's ulcers in the colon. With rheumatoid arthritis, it's painful joints. With MS, it's lesions in the brain. There are now over 100 different autoimmune conditions, and 1 in 4 Americans suffers from at least one autoimmune condition, and lots of people suffer from more than one. Autoimmune diseases are sometimes referred to as modern plagues because we've seen such an explosion in their incidence. And to understand what's behind that increase, we need to take a look under the hood at what's going on in the GI tract. Both genetic predisposition and environmental factors play a role in the development of most autoimmune diseases. But even for diseases where there's a strong genetic component, it's ultimately the environmental triggers that turn a genetic predisposition into an actual disease. And a lot of those triggers are happening in the gut. To illustrate how this works, I want to tell you about a brand new study published in the British Journal of Dermatology that provides some insight into what kind of triggers we're talking about when it comes to psoriasis, specifically the role of breastfeeding and early nutrition. This study used data from a large registry called ABIS, which stands for All Babies in Southeast Sweden. And it includes over 17,000 babies born between 1997 and 1999 that have been followed for more than 20 years. And the study involves questions about nutrition, infections, psychosocial factors, living conditions, life events, and it starts at birth with these babies and continues into young adulthood. And one of the first questions the Swedish researchers set out to answer was this issue of whether breastfeeding is protective against developing psoriasis. And the results showed pretty unequivocally that yes, breastfeeding is protective against developing psoriasis. In this study, children who were breastfed for less than 4 months had a higher risk of psoriasis, and introducing infant formula before 4 months of age doubled the risk of psoriasis. Now, when I was in medical school at Columbia, I distinctly remember doing my pediatric rotation and walking into Babies Hospital, that's what it was called, and I was in the clinic at Babies, and there was a poster on the wall, and the poster was encouraging women to breastfeed. I remember that it was sponsored by an organization, a nonprofit called La Leche, which means the milk in Spanish. And the poster was encouraging women to breastfeed, and it was basically saying that breastfeeding could protect against autoimmune diseases like Crohn's. And I remember at the time, I was like a third-year medical student. I remember thinking, that's crazy. What does breastfeeding have to do with Crohn's disease? Like, what are they talking about? Well, turns out they were spot on. Human milk oligosaccharides, HMOs, are the 3rd most common ingredient in breast milk, despite the fact that they are completely indigestible by infants. So why is a 3rd most common ingredient in breast milk indigestible by the baby? Because it's not there to feed the baby. HMOs are there to feed the baby's bacteria, species like bifidobacterium that repel staphylococcus and other harmful microbes on the mother's nipple. So compounds in breast milk, like HMOs, feed the baby's growing army of good bacteria that help protect the baby from more harmful species. Breastfed babies in the US have a 20% higher survival rate than formula-fed babies. And a lot of that difference in survival rate is because of ingredients like HMOs. Breastfed babies in the US also have less autoimmune diseases like psoriasis in childhood and adulthood, and that is also true in Sweden and many other more developed countries. The Gut Bliss podcast is brought to you by Vis Biome, my first and quite frankly, my only choice for a probiotic. Whether you're dealing with irritable bowel syndrome or just looking to restore your gut health, Vis Biome can help. It's a medical food for the dietary management of IBS and gut inflammation. Backed by science and clinically vetted by thousands of my own patients. Find your gut bliss with Vis Biome. Go to visbiome.com/gutbliss and use discount code GUTBLISS at checkout. The Swedish study also found that early introduction of cow's milk during infancy was a risk factor for developing psoriasis. And it's unclear whether that's because of the milk itself and proteins in milk, or because it's displacing the positive impact of breast milk. Eating a lot of fish from the Baltic Sea was also a risk factor. And these are fish that are known to contain a lot of toxic compounds, including heavy metals that can affect the gut. And we've seen similar effects in the gut from things like emulsifiers and preservatives in ultra-processed foods. So in Sweden, it's recommended that pregnant women and children not eat fish from the Baltic Sea more than once or twice a year. So kids who are eating more of that, particularly early on, that was also associated with higher risks of psoriasis. One of the major conclusions of this Swedish study was that nutrition matters when it comes to autoimmune diseases like psoriasis. And in this particular study, nutrition early in life at age 1 turned out to be more important than nutrition at age 3. And it's not that nutrition at age 3 wasn't important, but what the baby was eating in that first year of life was critical for preventing diseases like psoriasis. Now, that makes sense based on what we know about the development of the microbiome. Although the microbiome continues to develop from birth up until around age 18, it's most fragile early in life when those new species are colonizing the gut and the rest of the body. And that's why antibiotic use in early childhood, when the microbiome is really tender, is so devastating. And it's so strongly associated with autoimmune disease later in life. So when I'm talking to patients, and I treat adult patients, but they're asking about their kids and they're asking about antibiotics for acne or antibiotics for a little cold, I really am constantly encouraging them to really press the pediatrician and to say, is that antibiotic really necessary? Because the reality is that cumulative antibiotics in childhood is a major risk factor for autoimmune diseases. Now, if you're an adult and you already have psoriasis, you may be thinking that there's not much you can do about that in terms of whether you were breastfed or not and what you were given to eat as a baby. And that's true. We can't sort of turn back the clock. But even though the microbiome is relatively stable in adulthood compared to infancy, what you eat is still the most powerful tool to improve the composition and the diversity of your gut microbiome. It's not prebiotics or probiotics or short-chain fatty acid supplements. It's food. And of course, that dietary influence on your gut can be either positive or negative, depending on what you're actually eating. We could spend days talking about the impact of food on the gut microbiome and how that can affect different diseases. But the writer, Michael Pollan, summed it up really nicely in 7 succinct words. Eat food, not too much, mostly plants. And the plant part is easy, right? Fruits, vegetables, nuts, seeds, beans, whole grains, herbs, spices. That's easy. We know those are all really good for us. It's the food part that's a challenge. Remember, the first 2 words are eat food. But so much of what is presented to us in the supermarket and at restaurants and at the airport is not actually food. It's edible food-like substances. Long shelf life products that are derived from food, but full of chemicals that are engineered to make us want to eat a lot of them and engineered to be able to sit on a shelf literally for years and never go bad. They have emulsifiers and artificial sweeteners and dyes and preservatives. and they are damaging our gut lining and our gut microbes, and they are contributing to this explosion of autoimmune diseases that we're seeing. I am not a dermatologist. I am just a lowly butt doctor. But a lot of the patients I treat with autoimmune GI diseases like Crohn's and ulcerative colitis also have skin conditions like psoriasis. And I have witnessed dramatic improvements in their skin when the inflammation in their gut clears up through a food as medicine approach. And that's part of why I'm so interested in this gut-skin connection, because I've seen firsthand how what's going on in the gut can profoundly impact what is showing up on the skin. One of my really close friends has suffered with psoriasis since childhood. And when I told her I was doing this podcast episode, she generously offered to share a little bit of her story. So in her own words.
At about 10 years of age, I moved from a small island of Jamaica to Canada. And what I didn't know at the time was that 2 years later, I would be afflicted with a lifelong autoimmune disease. And I realized only in hindsight that that transition from Jamaica to Canada was really pivotal, because during that time, I experienced a whole different cultural phenomena where I had to assimilate to a whole new culture and language. I changed my diet. Largely, I was accustomed to eating locally grown foods and home-cooked meals, and more to pastas and pizza and things that I'd never eaten before. Notwithstanding that, I think that transition also put a lot of stress on me as a 10-year-old. But within 2 years of being in Canada, I slowly started to notice my scalp was covered with small white scales. Invariably, that moved to my elbows, my knees, my legs, and in due course, I would be afflicted with psoriasis. Now, I started off at a tender age of 12 being forced to use steroid creams and a whole series of treatments really to help with the skin condition, partly because it had metastasized, if I can use that word. But once that stopped working and I moved to photochemotherapy, I ultimately started with a set of biologics, which I'd been on for a little over 20 years. And maybe about 2 years ago, I stopped using the biologics on the recommendation of a very good friend who happens to be a doctor. She suggested that I should think about changing my diet and really doing more to move, like exercise, even though I'd been a runner previously. But the truth is that with the biologics, it was hard to tell, what was working and what was not working. So when I stopped taking the biologics, I noticed that the skin condition did not return. And except for maybe a small patch here and there on my elbows, that really is the extent of my experience with psoriasis now. I now am accustomed to eating more greens. I have green smoothies in the mornings. I do more salads and soups. And of course, every now and then I have a bit of chocolate cake and I stop drinking alcohol. But the truth is that I think it's a combination of my diet, the exercise, and leaving a highly stressful job has probably contributed to the psoriasis being under control. And I must say that while my skin is not really perfect, I believe I have been able to manage easily with a little bit of a topical coal tar ointment on my elbows every now and then. But what I'm learning is that my skin responds differently to foods, to exercise, and really to stress.
So I want to leave you with 3 takeaways about what you can do to improve your skin if you are struggling with a condition like psoriasis, and really, even if you're not struggling with psoriasis. Number 1, take the ultra-processed foods out of your diet completely, or as much as you can. If you can get them down to less than 10%, that works. Those industrially manufactured food products with a long list of chemical ingredients that you don't recognize, get rid of them. If you want to learn more about what an ultra-processed food is, check out the NOVA classification, N-O-V-A. Number 2, ramp up your consumption of unprocessed plant foods. I'm talking green leafy vegetables, fruits, beans, nuts, seeds, spices, herbs, whole grains. If you have to focus on just 2, highly recommend beans and greens be the ones you focus on. The American Gut Project taught us that 30 or more different plant foods per week is essential for a healthy microbiome, so really focus on your variety. Number 3, medications like steroids and biologics can be life-changing for people with autoimmune diseases. They're potent drugs. They can really help transform people's disease and improve their quality of life. But they come with significant risk, because when you are suppressing the immune system, you are also increasing the risk of infection and increasing the risk of cancer and several other problems. So talk to your doctor about other options, topical options like coal tar that has worked pretty well for my friend. For more on a gut-based approach to skin conditions like psoriasis, including specifics on what to eat, ingredients to avoid, safer ways to cleanse the skin, and my favorite edible skincare product recipes that you can whip up in your kitchen, check out the Gut Bliss Guide to Healthy Skin, which you can find at gutbliss.com under Gut Guides. Coming up next week on the Gut Bliss podcast, the final episode in our gut skin series, where I'm going to be talking about eczema and rosacea. Go to gutbliss.com for my free 7-day microbiome reboot course. If you like what you're hearing, drop a review and hit that subscribe button. And remember, dirt, sweat, vegetables, the best prescription for a healthy gut.
The information presented in this show is not meant to be medical advice. Consult your doctor before making any decisions about your health. The patients discussed are real people, but names and identifying features have been changed to protect their privacy.